Hi, my name's Jill Tomlinson and I'm a plastic surgeon who specialises in hand surgery. In this video, I'll discuss treatment options for adults who have carpal tunnel syndrome. If you've been sent the link to this video by my office, it's either because you or your doctor have advised my clinic staff that you have carpal tunnel. Occasionally, we discover through this video, or when I see you, that you don't have carpal tunnel syndrome and that your symptoms are due to another condition. Or we might discover that you do have carpal tunnel syndrome, but you also have another condition. For the purposes of this video, I will assume that you only have carpal tunnel syndrome. In the video, I'll explain what the condition is and the recommended non-surgical and surgical treatments. While the decision on what treatment to proceed with is ultimately one that we should confirm together after a discussion and examination of your hands, the information in this video is designed to assist you in understanding your treatment options and deciding what treatment is the best one for your individual circumstances. So what causes carpal tunnel syndrome? Understanding the anatomy is key to understanding the condition, the surgery, and the recovery. The carpal tunnel involves a tunnel with bones at the back and a tough ligament going across the top. In carpal tunnel syndrome, the carpal tunnel is too small for the contents within, so the nerve gets compressed. In the carpal tunnel surgery, we cut the ligament so it springs apart, giving more space for that nerve. In the recovery, your body then fills in that gap, making it strong again. It's the pressure on the nerve that gives all the symptoms in carpal tunnel, whether that's the tingling and the pins and needles, the pain at night, the weakness of the thumb, or the difficulty in picking up small objects. Are we certain that you have carpal tunnel syndrome? That's one of the things that we'll discuss in your consultation. Carpal tunnel syndrome can be diagnosed by nerve conduction studies, by ultrasound, or by clinical symptoms. If there's any uncertainty, then I will refer you for nerve conduction studies. What are the treatment options? Broadly speaking, non-surgical or surgical. Most people have already tried non-surgical treatments by the time they come to see me. That can include splinting at night and cortisone injections. The non-surgical treatments can be very successful in many people, but in some people, surgery is required. The types of surgery involve endoscopic or keyhole surgery or open carpal tunnel release. The process of surgical treatment is slightly different depending on whether you have the keyhole carpal tunnel surgery or the open carpal tunnel surgery. But in both operations, the ligament needs to be completely cut. In the keyhole carpal tunnel surgery, we make a little incision at the wrist and go inside that way. We see the ligament as being the roof of what we're looking at, and we cut it there. We back out, stitch, bandage, and you start your recovery. With the open carpal tunnel, we make an incision on the palm, go through and cut the ligament, stitch you up, bandage on your hand, and then you start your recovery. So what are the differences between open carpal tunnel surgery and keyhole or endoscopic carpal tunnel surgery? There are differences in the type of anaesthetic that you'll have for the operation. If you wish to be asleep for the operation, you can be asleep for either method. If you wish to have the keyhole carpal tunnel surgery, you will have a general anaesthetic. If you wish to have the surgery done under local anaesthetic alone, or local anaesthetic with sedation, then the open carpal tunnel operation is the operation for you. I don't usually find that people make a decision based on where the incision is or what type of stitches are used or where the stitches are placed. One of the things that might encourage people to have an endoscopic carpal tunnel operation is the fact that, generally speaking, there's a faster early recovery if you're looking at performing administrative type duties. The recovery is no faster with the keyhole surgery if you are looking at heavy duties, because the heavy duties are about whether the ligament that gets cut completely in each surgery, whether that's gotten strong again. So at the 6-week mark, it doesn't matter which type of surgery you've had, the recovery is meant to be the same at the 6-week mark. One of the important things to know about the keyhole surgery is that it does have a slightly greater risk of nerve injury. Therefore, if you're electing to have the keyhole surgery, I'll talk to you more about the slightly greater risk of nerve injury and how that might apply to you. When I think about the recovery process after carpal tunnel surgery, I think about the skin, the ligament, and the nerve. The skin will be covered with a bandage for 1 week. That bandage goes across your palm and across the wrist, so your thumb and your fingers are free. You can move your fingers, you can move your wrist, and the skin will heal. Occasionally, there's an overly aggressive stitch reaction or even an infection, although that's pretty rare. When I think, though, about the ligament, I'm thinking of a 6-week recovery process because it's going to be at least 6 weeks before you can engage in heavy gripping or lifting. And if you push things too hard in the early weeks and you don't listen to your hand when it says that it's very sore to grip, you will prolong your recovery. When I think about the nerve, I think about great variability. Some people report a week after the surgery to me that they've got completely normal sensation. They haven't had any funny tingling or numbness since the local anaesthetic wore off after the surgery. Some people, though, will tell me that they've got quite a lot of pins and needles or numbness, particularly at the tips of the fingers. That's a factor of how severe the nerve compression was and how long the nerve compression continued for before the surgery. In some instances, but it's pretty rare, you won't regain normal sensation after the surgery because the nerve had simply been compressed for too long. That's very unusual, and in most people, after about 9 to 12 months, the nerve sensation will have recovered and will have recovered completely. Thank you for your time. I hope that this video has been useful for you in helping to understand the treatment options for carpal tunnel syndrome and the recovery from surgery. I look forward to seeing you at your appointment and to helping to get your hands and wrists back on track. Thank you.